A migraine is a disabling condition that causes an extremely painful headache, accompanied by nausea or vomiting and sensitivity to light and sound.
Some people can't get out of bed. They have to lay in bed all day, lay in a quiet, dark room. People has missed family functions. They'll miss work. Some people have to go to the ER or urgent cares multiple times a month, so they can be very debilitating.
While the exact cause of migraines has yet to be pinpointed, it's clear that several factors may increase your chance of having migraines, including family history, age, and gender. Women are about 3 times more likely to get them than men.
You can notice that you'll have different contributing factors such as the weather, certain types of foods, stress, illness, lack of sleep. All of those can play a factor in what increases migraines.
If you suffer from migraines only occasionally, you're said to have episodic migraines. If you have 15 or more headaches per month, with at least 8 of them being migraines, you suffer from chronic migraine. At HIMG Neurology, chronic migraine sufferers are finding they can prevent headaches and migraines before they even start. With Botox, the #1 and first FDA-approved preventive chronic migraine treatment on the market.
Botox is a series of 31 injections that we do in the head and neck area. We give it every 3 months. And what it does, it relaxes the muscles, but it's uptaken in the trigeminal nerve and therefore helps reduce the number and the severity of headaches. The needles are really fine, really small. I try to tell all the patients up front about what to expect for each procedure, tell them how it'll go, and they seem to do pretty well with it.
Usually by the second treatment, patients experience 8 to 9 fewer migraine days per month.
I always tell people to give it 2 rounds because it usually kicks in after the second round, but some people can experience relief as soon as after the first round or within a week or so after we do it. Not typical, but they can. 80% of patients usually notice some type of improvement, but again, there is people occasionally that won't have a response, but overall, it's been a really good response here at HIMG.
As with all pharmaceutical therapies, you should understand the potential side effects.
Possible side effects of Botox is really anything to do with the effects of Botox and muscle weakness. So there is possible neck weakness, weakness of the facial muscles over the eyes, which would be kind of an eyebrow droop. So those are all possible side effects with Botox.
So when should you seek treatment for headaches?
Definitely if they're really starting to bother you, affect your life, if you're missing family functions. And it's always important to seek treatment for headaches if you don't have a history of them, if they're new or sudden onset, or you would characterize it as the worst headache of your life. Any stroke-like symptoms with your headaches, with or without your headache, that's definitely when you would want to seek treatment.
For more information, or to schedule an appointment to find out if Botox treatment for chronic migraine might be right for you, call HIMG Neurology at 304-528-4683.